to warm the middle region and disperse coldness. This involves treating the spleen, stomach, yang deficiency syndrome, with such symptoms as cold pain at the pit of the stomach and in the intestine, vomiting, diarrhea, fat tongue with a white and sliding coating, and deep and slow pulse or deep and tight pulse. The spleen yang deficiency syndrome with abdominal pain, love of warmth, abdominal swelling, watery stools, and cold limbs, and the cold stomach syndrome with pain at the pit of the stomach that drags on and lessens with warmth or heat, vomiting of clear water, and more. In clinical practice, the spleen stomach yang deficiency syndrome is encountered most frequently as the spleen and stomach form a yin-yang relationship with each other, so their symptoms will also affect each other. To restore yang and rescue upsurging. This is used to treat yang prolapse syndrome with the following symptoms: dislike of cold, lying down with body curled up, extremely cold limbs, vomiting, and diarrhea, body temperature decreasing, pale complexion, and fine and disappearing pulse or hollow and rapid pulse. To warm up meridians and disperse coldness. This is designed to treat the meridian coldness syndrome with the following symptoms: cold pain in the forelimbs, poor blood circulation, blue tips of the forelimbs, rheumatism with coldness, cold pain in the muscles, and difficulty in flexing and extending the joints. The method of tonification. This treatment principle is an important one in Chinese medicine, as it can be applied to deal with inherent deficiency and acquired deficiency alike, so long as there are signs of yin or yang deficiency, energy deficiency, blood deficiency, shortage of semen or shortage of fluids, and so on. There are 4 methods of tonification: to tone up energy deficiency, blood deficiency, yin deficiency, and yang deficiency. To tone up energy deficiency. This involves treating the energy deficiency syndrome, the lungs energy deficiency syndrome, and the spleen energy deficiency syndrome. These syndromes may give rise to the following symptoms: fatigue, weakness, shortness of breath, too tired to talk, feeble and low voice, asthma triggered by labor or movements, whitish complexion, poor appetite, watery stools, excessive perspiration, edema, weak pulse, prolapse of the anus, and prolapse of the uterus. To tone up blood deficiency. This is used to treat the blood deficiency syndrome with the following symptoms: pale or withering and yellowish complexion, pale lips and nails, dizziness and spots in front of the eyes, palpitations, insomnia, irregular menstrual periods, scant menstrual flow and light color, numbness of hands and feet, pale tongue and fine pulse. To tone up yin deficiency. This is used to treat the yin deficiency syndrome with the following symptoms: loss of weight, dry mouth and throat, dizziness, ringing in the ears, sore loins and weak legs, red tongue with scant coating, and fine pulse. The same treatment principle is also effective for the deficiency fire syndrome with the following symptoms: red lips, reddish appearance in the zygoma, feeling depressed, insomnia, hot sensations in the middle of the palms and the soles of the feet, periodic fever, night sweats, seminal emission, and discharge of blood from the mouth. To tone up yang deficiency. This is used to treat the yang deficiency syndrome with the following symptoms: fear of cold, cold limbs, sore loins, weak legs, cold pain across the loins or in the legs, impotence, sliding ejaculation, a long stream of plentiful clear urine, pale tongue, and deep, fine, and weak pulse. All of these symptoms are mostly seen in the kidneys yang deficiency syndrome, the heart yang deficiency syndrome, and the spleen yang deficiency syndrome should be treated by the principle of warming up. The method of eliminating. This method of treatment is for such disorders as indigestion, swelling, accumulations, stones, ulcers, and parasites. It can be broadly divided into 2 categories: to eliminate hardness and to eliminate coagulations. To eliminate indigestion. This treatment principle is designed to cope with symptoms arising from indigestion as follows: fullness of stomach, abdominal swelling, acid swallowing and belching of bad breath, nausea, vomiting, poor appetite, abdominal pain, constipation, diarrhea, and thick and greasy coating of the tongue. To eliminate swollen lumps and expel stones. This principle can be applied in treating swollen lumps such as of the liver and the spleen, and heart symptoms and tumors, as well as liver stone, gallstone, urinary stone, and so on. To eliminate carbuncles and drain off pus. This principle is designed for such external infections as carbuncles, abscesses, boils, and furuncles. In clinical application, a further distinction between the Yang syndrome and the Yin syndrome is made. The Yang syndrome includes the following symptoms: acute onset redness, swelling, heat, pain, and sticky fluids in cases of ulcers. The Yin syndrome includes slow onset, white and spreading, swelling, hardness with aching pain, and clear and thin fluids in cases of ulcers. To eliminate sputum and soften up hardness, this principle can be applied to deal with hard sputum in the meridians with the following manifestations: lipoma, fibroma, tuberculosis, lymph node, goiter, nodular goiter, carcinoma of the thyroid, simple goiter, and so on. The method of inducing vomiting. Of the 8-gram methods of treatment, including vomiting, is the last. It is used to prevent poisoning and suffocation, consumption of toxic foods, presence of indigestible substances in the stomach, apoplexy, and epilepsy. Herbology. In Chinese medicine, diseases are often treated with herbs. Applications of Chinese herbs in clinical practice are based upon the nature and capabilities of herbs, and they, in turn, are based upon the energies, flavors, movements, and meridian routes of herbs. The 4 energies. The 4 energies of herbs are cold, hot, warm, and cool. These classifications are derived from the effects of herbs as originally observed from actual applications by the ancient Chinese. When an herb has proven effective in the treatment of a hot syndrome, that herb is considered to have a cold energy. When an herb has proven effective in the treatment of a cold syndrome, it is considered to have a hot energy. The 4 energies of herbs can be broadly divided into yin and yang, with cold and cool energies belonging to yin and hot and warm energies belonging to yang. Since the difference between cold and cool and between hot and warm is only a matter of degree, Chinese physicians are in the habit of using such expressions as extremely warm or slightly warm and extremely cold or slightly cold. The 5 flavors. The 5 flavors refer to pungent or acrid, sweet, sour, bitter, and salty, which are distinguished from each other by the sense of taste. The ancient Chinese distinguished various actions of herbs through a very long process of clinical experience, and they came to the conclusion that pungent herbs can disperse, sour herbs can constrict, sweet herbs can slow down, bitter herbs can harden, and salty herbs can soften up. This was clearly recorded in the Yellow Emperor's Classics of Internal Medicine. Subsequently, Chinese physicians have further discovered that pungent herbs can disperse and promote the flow of energy. Sour herbs can construct and obstruct. Sweet herbs can tone up and harmonize. Bitter herbs can dry up and cause diarrhea, and salty herbs can soften up and promote downward movements. In addition, there is another classification called tasteless flavor, which can also help dampness, seep, and promote urination. But as a tasteless flavor is similar to sweet flavor, the two are generally classified under the same flavor, which is why a celebrated Chinese herbalist has said, tasteless flavor is associated with sweet flavor. The 4 movements. The 4 movements of herbs are to push forward, to push downward, to float, and to sink. To push upward means that a given herb is capable of elevating falling symptoms as with the prolapse of the anus and uterus or the internal organs. To push downward means the herb is capable of suppressing upsurging symptoms, as with hiccups and cough. To float means that the herb is capable of dispersing outward, as with inducing perspiration. And to sink means that the herb is capable of promoting diarrhea and directing energy downward. The herbs that can push upward and those that can float have the common functions of moving upward and outward, with such actions as inducing perspiration and vomiting, as well as elevating yang energy. On the other hand, the herbs that can push downward and those that can sink have the common functions of moving downward and inward, with such actions as relieving, vomiting, checking perspiration, and inducing diarrhea. Meridian Routes. The meridian routes refer to the meridians a given herb is capable of entering and traveling through, which accounts for two herbs with identical energy and flavor still displaying two different actions. In clinical application, herbs are selected that travel through the meridians in the diseased regions. For instance, a hot herb is used to treat a cold disease, and a cold herb is used to treat a hot disease, which are standard procedures in Chinese herbal therapy. But two herbs may have different actions, with one herb being good for the cold lung syndrome while the other being good for the cold liver syndrome. By the same token, one cold herb may be good for the hot spleen syndrome, whereas another cold herb may be good for the hot lungs syndrome. Actions. All important Chinese herbs or herbal formulas have a number of common actions, which is why they are considered important. In Western medicine, an antihistamine is used to counteract the effect of histamine, which is the action of an antihistamine. Similarly, Chinese herbs or herbal formulas have various actions, but they are expressed in different terminologies, such as to clear heat, sedate fire, or stop wind. The terminologies used for treatment principles and actions are identical. Thus, when a given formula can clear heat, its action is to clear heat, which may be used to treat the hot syndrome. A formula may have, say, 4 common actions: to clear the lungs, transform sputum, cool the blood, and counteract toxic effects. A doctor of Chinese medicine knows how to use this formula simply by identifying its common actions. Since this formula can cool the blood, we can use it to arrest bleeding. As is in the case of nosebleeds, since it can clear the lungs, we can use it to suppress cough associated with the lungs. Since it can transform sputum, we can use it to reduce mucus discharge in cough and asthma. And since it can counteract toxic effects, we can use it to heal swelling and boils in the skin. Thus, the common actions of Chinese formulas are very important in clinical applications. But it takes quite a while for a person to fully understand the meaning of the common actions of formulas and learn how to apply them in the treatment of diseases. The basic reason is that in order to make use of common actions of formulas, one needs to know how to make a diagnosis of a disease, which is not a very easy task. Even if we know, for example, that this particular formula can cool the blood, we still have a long way to go before we are able to apply it to arrest bleeding. There are many possible syndromes that account for bleeding, including the wind-cold syndrome, the spleen unable to govern the blood syndrome, external injuries, the large intestine excess syndrome, and the hot blood syndrome. If a formula can cool the blood, it can only be applied to treat nosebleed that falls within the scope of the hot blood syndrome in order to be effective. A doctor of Chinese medicine must make a diagnosis to determine if this particular case of nosebleed, for example, falls within the scope of the hot blood syndrome, before he or she can apply to treat nosebleed. In addition, in order to determine the right syndrome of a nosebleed, the doctor needs to follow the standard procedures of Chinese diagnosis, which involve the theory of yin and yang as well as the Chinese organ theory. Herbal formulas. In most cases, a syndrome has more than one symptom that cannot be treated by one single herb. Thus, in Chinese herbal therapy, several herbs are used together in a formula in order to cope with the conditions of a disease. This is called compound therapy in Chinese medicine. Over the course of history, the Chinese have established more than 20,000 formulas, of which about 2,000 are currently in use. Although a physician of herbal therapy can use his or her own formulas to treat patients, Established formulas have been proven effective in the past, and for this reason, they should be used for clinical applications whenever possible. A standard herbal formula consists of a king herb, subject herb, assistant herb, and servant herb. According to the Yellow Emperor's classes of internal medicine, the primary herb in a formula is called the king herb. The herb included in the formula to assist the king herb is called the subject herb in that formula, and the herb included in the formula to be responsible to the subject herb is called the servant herb. Every formula must have at least a king herb, but not every formula needs a subject herb, an assistant herb, or a servant herb. Sometimes a formula may have a king herb that also plays the role of a subject herb, just like a prime minister may also act as the finance minister in a cabinet. As a general rule, the king herb in a formula has the largest dose, followed by the subject herb, the assistant herb, and the servant herb. The king herb in a formula, the king herb is the herb that is primarily responsible for dealing with the syndrome under treatment. For instance, if the patient has been diagnosed as suffering from the cold syndrome, the king herb must be capable of warming up the body. If the patient has been diagnosed as suffering from the kidney yang deficiency syndrome, the king herb must be capable of toning up the kidney's yang. Many formulas have more than one king herb because a syndrome often contains two basic conditions that need to be treated simultaneously with two different herbs. Take the gallbladder dampness heat syndrome, for example. This syndrome contains two basic conditions, namely gallbladder dampness and gallbladder heat. So the formula selected to treat this syndrome may contain one herb to remove gallbladder dampness and a second herb to clear gallbladder heat. The subject herb. An herb in this category assists the king herb in two different ways. It reinforces the action of the king herb from a different angle, and it treats the concurrent syndrome. For example, when the king herb in a formula is used to induce perspiration, a subject herb can be selected to produce body fluids to reinforce the function of the king herb in inducing perspiration. Sufficient body fluids will make perspiration easier, which means that the subject herb is helping the king herb achieve its objective indirectly. Another example is that when a person is suffering from two syndromes simultaneously, with one syndrome as the main one, the other syndrome as the concurrent one, the king herb will deal with the main syndrome while the subject herb will deal with the concurrent syndrome. As with king herbs, a formula can contain more than one subject herb. The assistant herb in a formula, the assistant herb can play one of the following three roles. It can assist the king herb or the subject herb in dealing with a relatively minor symptom. It can control the undesirable drastic actions of the king herb and the subject herb, or reduce their toxic effects, and it can play the role of an opposition to supplement the action of the king herb. The servant herb. In a formula, the servant herb plays two basic roles. It can direct the formula to the affected region, and it can harmonize the herbs in the formula. How to take herbs. After herbs are put together in a formula, they must be prepared for consumption. There are three common ways of taking a formula: decoction, powder, and tablets. Decoction. As many Chinese formulas have been made into tablets, and many are also available in powder form, it has become less important for people to know how to decoct formulas. Nevertheless, the vast majority of Chinese formulas are still not available in either tablets or powder, which means that they need to be decocted. Moreover, herbal formulas that have been decocted are readily absorbed and take effect more quickly, which is beneficial for acute disorders. In order to produce the best therapeutic effects, formulas should be decocted according to established methods. The pot used for decoction should be made of something other than iron or bronze in order to prevent chemical changes. Usually an earthenware pot is used instead. Place the herbs in the pot, add cold water just enough to cover all the herbs, and then add one more cup so that the water will be about half an inch higher than the herbs. Stir a little bit and let the herbs soak in the water for about 20 minutes. Then bring the water to boil. As soon as the water begins to boil, reduce the heat to low. both to keep the water from overflowing and to prevent its premature exhaustion. During the course of decoction, the pot should be covered and not opened too frequently in order to retain the volatile constituents of some herbs. The quantity of the water used varies with the herbs and the heat because some herbs absorb more water than others and thus need more water for decoction, and high heat consumes more water than low heat. Before decoction, herbs should be soaked in water for about 20 minutes to make them soft and moist. The same water should be used for decoction to prevent any loss of the herb's potency. The total decoction time depends upon the herbs being decocted. For instance, herbs for inducing perspiration can be decocted over high heat for less than 10 minutes. After the water starts boiling, and herbs for strengthening the body, traditionally called tonics, can be decocted for as long as an hour over low heat. After decoction, the herbs are strained. When a Chinese patient gets a prescription from a doctor, he or she usually brings it to an herb shop for filing. The clerk at the herb shop will wrap up the herbs in small paper bags and give instructions for each bag to be decocted 2 to 3 times for oral administration. Normally, each decoction is to be taken all at once as one doses, usually in 1 or 2 cups, and 2 dosages are taken a day. The same bag of herbs can be decocted in the morning and then again in the late afternoon. Sometimes it may be necessary to decoct the heavy or hard herbs like wood or roots over low heat for 10 to 20 minutes first, so that their constituents will become fully soluble in boiling water. Clinical experiences have shown that such heavy herbs can be decocted repeatedly to produce good results. After heavy and hard herbs have been boiled for 10 to 20 minutes, add the aromatic herbs, and then the very light herbs such as leaves and flowers, which should be decocted for only about 5 minutes or so in order to prevent evaporation of some constituents like essential oils.